Welcome back.
Yeah, thank you so much, Chris, for having
problem.
me.
Yeah, thanks for being here. I know we had there's a big time difference and everything, so I appreciate you joining us. And maybe you can tell us a little about where you are and what you're studying and how you got into researching misophonia in the first place.
Okay, myself Sajana Aryal, and I'm currently in Nepal. I'm from the beautiful country Nepal, and I'm an audiologist by profession, and now I'm working as a clinical audiologist here at Nepal at Speech and Hearing Clinic. Regarding my educational background, I did my undergraduation in audiology and speech language pathology from Nepal, and I did my post-graduation in audiology from India.
Wow.
So I'm a fresh researcher, like I started researching 2 years back, and since then I have authored around 10 papers, and most of them are related to misophonia, tinnitus, and hyperacusis.
That's awesome. Yeah, and one of the things I've noticed, you've published several papers very recently. If you look at our website, Michelle will post a link to our page with all of the misophonia research. And in the audiology field, the last 3 or 4 papers that have been published at all, thank you, Michelle, are by you and Dr. Prabhu. So you are sort of a leader in the audiology field in researching misophonia, which is incredible.
Yeah, thank you so much for the compliment. And like I didn't know about the misophonia much during my undergraduation period, and while searching for the topic of my dissertation during the post graduation, and I was like little worried about the topic. And while seeing the literature, I came across one blog of misophonia, I think, which was related to suicidal case report of misophonia. Then that blog differently hits my mind. Then I reviewed the literature of misophonia, and like even the pioneer of misophonia was audiologist, there was a huge gap in the literature on misophonia research from the audiological perspectives. So me and Dr. Prabhu started doing research on misophonia, and at the same time, soQuiet provided us the student grants, which motivated us to do more research on misophonia. Yeah, that's how we started doing research.
Yeah, it's really fascinating to see misophonia. The word was coined by audiologists about 22 years ago. And then it kind of sat for about 10 years unknown. And so we'll get to your papers in a second. One of the papers you published in December or late last year, 2022, was an overview of audiology studies on misophonia, and that sort of formed the foundation for the next 2 papers. So tell us where is the field of audiology at when it comes to misophonia? What do we know, and how are audiologists able to be a part of that research?
Yeah, this is a very good question, Chris. At first, I will quickly highlight the research that has been done in Asian countries, especially India, from the audiological perspective, and we will move towards the questions. Is it fine, Chris?
Let me see if there we go. Okay, go ahead.
You all know, like misophonia is the specific disorder in which certain sounds like chewing or swallowing create the intense emotional arousal among the sufferers. So the assessment and management of the misophonia needs the team approach, and audiologists are the key members of the team. However, if we see in developing countries like Nepal and India, Even different professionals which are getting involved in assessment and management of the misophonia are not aware about the role of the audiologist. And also audiologists themselves are not aware about the uh, different treatment approaches and assessment protocols they can use for the individual with misophonia. So this is the one research which I want to talk, which has been done in Indian context. And we recently did this paper, and through this paper, we try to understand the awareness and perspective of audiologists on assessment and management of misophonia. So from this study, what we got to know is most of the audiologists are aware of the word misophonia, but among 200 working audiologists who participated in the survey, only 15.3% of audiologists reported being confident in handling the cases of misophonia. So this result clearly shows even audiologists are not aware about the uh, different treatment approaches that can be used for the assessment and management of the misophonia. So moving next, I will talk about the few studies that were done to find the prevalence of misophonia in Indian context. So this is the study done in 2021, and we tried to see prevalence of misophonia among students of Mysore universities. This is the university situated in southern part of the India, and from the study we got to know around 48% of the participants have at least one symptoms of the misophonia, which is really the huge populations. And after administering this misophonia questionnaires, Amsterdam misophonia scale, we got to know around 23% of the students who participated to the research has a clinically significant misophonia. So again, we found that misophonia occur as a comorbid condition with auditory disorders like tinnitus, hyperacusis, and also with the psychiatric disorders like anxiety, depression, and schizophrenia, and so on. So moving towards the next study, this is the study done by the Dr. Prabhu and their team among the undergraduate students of the India, and they also reported around 15% of the students having moderate to severe degree of the misophonia. This is the study which we recently did among 607 university students of Amity University. So this is situated in northern part of the India, and from the study we found that around 27% of the participants having the symptoms of misophonia. And when we administer revised version of Amsterdam misophonia scale, we got to know around 17% participants having the clinically significant misophonia. So if we see this prevalence rate, we can say like the prevalence rate varies from 15% to 25% among the Indian population. And again, there is variation in the prevalence rate in the northern part of the India and southern part of the India. The various factors like difference in diversity, ethnicity, culture, race, and also the different in methodology used could be the various factor for the variation in the prevalence rate. Yeah, that's all about the prevalence. And moving towards this neurophysiological aspect of misophonia, like as you know, there are different findings across the literature. Various neuroscientists, psychiatrists, and even audiologists are working on understanding the neurophysiology of misophonia. Few researchers has said like there will be the hyperactivation of different regions of the brain like anterior cortex, hippocampus, amygdala in misophonia sufferers. And from another point of view, like some researchers has said there will be the abnormal connectivity of motor neuron system in misophonia. So similarly, other researchers, including Jastrobov, has said like misophonia is due to the abnormal connectivity of auditory system with the limbic and autonomic nervous system. So, to understand the depth of neurophysiology of misophonia from the audiological perspective, we did this review as the part of my thesis in my post graduation. And we reviewed 12 articles related to neurophysiology of misophonia. And from this review, we found that there won't be any problem in like auditory processing of the signals at the peripheral level in mesophonics. Like the processing of the signal from external ear to the subcortical level will be absolutely normal. Then beyond that, there will be like impaired sensory gating in mesophonics. Like sensory gating is mainly responsible to filter out the non-novel stimulus from the novel stimulus. If there is an impaired sensor gating, there will be the reduced inhibition and there will be the increased excitation, which will ultimately cause abnormal activation of different regions of the brain, including the auditory cortex and association areas. So another mechanism we found in the review and we also demonstrated through this model is there will be abnormal connection of auditory system from subcortical level to the limbic system and autonomic nervous system in the mesophonics, which cause the negative association of trigger sound with the emotions. And through the classical conditioning, the severity and symptoms of the misophonia might increase. So this is the one model which we proposed from the audiological perspective by reviewing the literature. So, to correlate and cross-check the findings of these neurophysiological research, uh, we did one project from the audiological perspective, which was funded by soQuiet non-profit organization. And in this project, we try to include all the audiological tests which assess the functioning of the ear from external ear to the auditory cortex. So, in this research study, we included various psychoacoustic tests, electroacoustic tests, as well as the electrophysiological test. So these are the findings of our study. Like it's impossible to explain in detail. I will grossly highlight the major findings of the study. Few has been published recently and few are under the review. I hope you will get chance to study in detail in the future. So we had done pure-tone audiometry and high-frequency audiometry among mesophonics, and results showed no any significant difference in the hearing sensitivity from 250 hertz to 16 kilohertz among the misophonia sufferers. So similarly, we did transient evoked autoacoustic emission to know about the functioning of the outer ear cells, and also results showed no significant difference in the mesophonics. Then again, we did this contralateral suppression of TEOE to know about the descending auditory pathway, also known as the efferent pathway that emerged from auditory cortex and uh, like a project to the outer hair cells of the inner ear. And the results showed again no significant difference in the misophonia sufferers in this test. Similarly, to assess the functioning of middle ear and middle ear reflex system, we did this tympanometry and reflexometry, and result didn't show any significant difference in this test as well. So moving towards the next finding, we did this auditory brainstem response test in mesophonics, which assessed the functioning of the ear from auditory nerve to the brainstem level. And again, results showed no any significant difference in the mesophonics. So the two tests which could be used as a clinical correlates of misophonia are loudness discomfort level test and ALLR, in which we found the significant difference in the mesophonics. So in the loudness discomfort level test, we found reduced discomfort level of the loudness among the mesophonics. And similarly in ALLR, we found early latency of P1 and N1 peaks of the ALLR among the mesophonics. So as I said earlier also, like research has shown hyperactivation of different regions of the brain, uh, which are the generators of P1 and N1 peaks of the ALLR. Like P1 peaks generated from thalamic projection, and it is associated with the sensory gating. As I said, there will be impaired sensory gating in the misophonics. It could be due to that, or it could also be due to the hyperactivation of the different cortical areas of the brain. And again, Yan1 peaks generate from primary auditory cortex and secondary auditory cortex of the brain. And again, we already discussed like fMRI studies has shown hyperactivation of these areas of the brain, and earlier latency of these peaks could also be due to that hyperactivations. Similarly, in P2 and N2 peaks, we didn't find any significant difference because these peaks were generated from more cortical parts and they were associated with the cognition. So, from the findings of this project, we can conclude that LDL and auditory late latency response test can be the clinical correlates of the misophonia from the audiological perspectives. Then again, as I said, misophonia is audiologic, psychiatric, and neurologic complex, and we need to cross-check the findings from the other area as well. These two tests only are not sufficient to diagnose the misophonia. So I will quickly highlight the difference of misophonia with other auditory disorder like tinnitus and hyperacusis here. So, as I said, in misophonia, there won't be abnormal processing of the sounds at the peripheral level. It's mainly due to abnormal connection of auditory system with the limbic and autonomic nervous system, or it could also be due to the hyperactivation of all few regions of the brain. But in tinnitus, research has shown various problems at peripheral level as well. Like there could be abnormal firing of the auditory nerve, or there would be abnormal spontaneous firing rate, and also the research has shown there could be abnormal processing of descending auditory pathway, and also research has shown abnormal brainstem functioning in tinnitus population. Similarly, in hyperacusis also, the pathophysiological mechanism is slightly different from the misophonia. There are few similarities and there are few differences as well. So, in hyperacusis, research has shown like there could be abnormalities in middle ear reflex system, or there could also be abnormalities of auditory efferent pathway system, or there could also be a problem in outer ear cells functioning, or so grossly speaking, there can be problem in peripheral mechanism as well. But misophonia is truly a central phenomenon, and there won't be any problem in processing of the signal at the peripheral level, which was confirmed by this neurological test as well as the audiological test. So those were the assessment protocols or research that we did from the audiological perspective. So moving towards the management of misophonia, what I feel is there is a lack of research on management, but this is the thing that is necessary for the sufferers. So different management technique like misophonia retraining therapy, like we tries to reduce the abnormal connection of auditory system with the limbic and autonomic nervous system, has been tried in the literature, but efficacy of this approach is not known, like it's not clear. In back in the 2015, Jastrov has done some case studies and reported it would be effective for the misophonia sufferers, but after that, I think, as of my knowledge, none of the studies has tried to know about the efficacy of this treatment approaches. So again, cognitive behavior therapy, like which majorly focus on changing the cognition, like changing the way the person think about the misophonia triggers, can also be tried in the misophonia. there are lack of the case studies in the literature, and in the future we can focus on finding the efficacy of these treatment approaches. So to conclude, I'll just conclude the summary of the research that has been done in the Indian context. So, as I said, even audiologists are not aware about the treatment possibilities that can be used in mesophonics. So, it's very much necessary to create the awareness among the general public, or as well as among the professionals, because misophonia sufferers should know whom to seek the help. Like they should know whom they should contact after having the symptoms or after having the problem. So it is necessary to create the awareness about the team approach that is used for the assessment and management, and we should highlight the role of the professional depending upon the comorbidity the sufferers is having, as well as the severity of the misophonia. So in the future, we need to focus more on the treatment possibilities for helping the individual with misophonia.
Awesome.
Yeah, that's it.
Cool. There's a lot of thank you for sharing that, by the way. There's a lot of things that come to mind. One of the things that I noticed was that's very interesting is your prevalence study. There's been a few prevalence studies around the world, but not that many. One recently that came out in the United Kingdom. But your prevalence study seems to indicate that it's pretty equal, give or take a few percentage points, to other prevalence studies that have been done. Sometimes people wonder if misophonia might be culturally related, and it looks like maybe since your prevalence numbers are very similar, around 1 in 5 people to the prevalence studies in the US and in the UK, that it might be a similar prevalence worldwide. In other words, it may be more of a thing that is going to match up regardless of culture. Does that seem to be your findings, that the prevalence is the same maybe everywhere in the world?
I don't think the prevalence is same everywhere in the world, because as I listed before also, the difference in diversity, culture, ethnicity, and like also what I feel is the way the person express their emotions also affect the prevalence rate. So okay, I'll just quickly mention the findings of the gender. In the prevalence study which we did among the Amity University, we found that females are suffering from the misophonia more than the male, because the way the male and female express their emotion is different. The sound, which could be disgusting or irritating for the female, can't be irritating for the male. It depends upon how they perceive the signals and how they perceive the triggers. So the difference in prevalence rate could be due to the a different number of the male and female they had taken in the study, and also the cultural background, difference in ethnicity, and yeah, and again due to the different methodology used. But it's used similar also, like it ranges from 5% to 25%. So, but while generalizing the result, we need to be aware about all these factors.
Yeah, we need a lot more research. It's fascinating. It seems like the two things that your most recent assessment study pointed out are that the sensory gating is an important aspect. And I'm curious about the LDL. That was a loudness measure. It seemed like people with misophonia have a lower score on the loudness measurement. Why do you think that is? What might that indicate?
Okay, what I feel is in hyperacusis, obviously there will be the loudness tolerance problem, but in misophonia, this is not always the case. Like some people can tolerate the loudness level of 120 dB as well, and for some people uh, they might have problem in tolerating the sound of 30 to 40 dB as well. So it depends upon the person to person. So uh, like LDL is not the only test to diagnose the misophonia, and the loudness perception depends upon the different setting and different type of the stimulus we used, and different type of the moment pattern that the sound created. So LDL is not what I feel personally is LDL is not only the test to diagnose the misophonia. We can do clinical correlation. Some people with misophonia might have a loudness intolerance problem, but other people can have a normal loudness tolerance capacity as well.
I see. And you had also mentioned sensory gating. That is mentioned a lot in misophonia. What is your take on maybe the correlation between sensory gating and maybe you can explain to us what that is? It's how your brain pays attention to or doesn't pay attention to certain sounds around you, right? How might sensory gating be related to your findings on misophonia?
Okay, sensory gating is the process which is responsible to filter out the irrelevant information and leaving the adequate space in the brain for the relevant information. So, as I said, there would be impaired sensory gating. It means the brain won't be able to filter out what information is necessary and what information is not necessary. So there can be the jumble of the thoughts and emotion in the brain, and which can cause different hyperactivation of auditory structure, and also could be the reason for not being able to regulate the emotions.
Yeah, sensory gating is fascinating. To me, it's people talk about you're at a party, right? And there's a lot of conversations happening at a party, but your brain automatically isn't paying attention to all of those conversations. It automatically filters them out. But if there's a specific conversation happening, your brain subconsciously can focus on the conversation that you're having with somebody and filter out all of the others without you thinking about it. That's kind of what sensory gating is, and it varies. Some people actually inadvertently or unexpectedly are sort of listening to those conversations, and it can get overwhelming. Is that kind of what sensory gating is?
Yes, yes, that is the sensory gating, and it's more of like cocktail party effect. Like when we
Mhm.
go to the party, our brain will ignore the different repeating sound that is occurring in the background, and we can focus on the relevant stimuli. And sensory gating is not exactly same as cocktail party effect, but it's similar kind of the phenomenon. So when the person I'll just give one example. When a person is repeatedly exposed to sound of bus running bus on the train or on the road, then after the some hours or after the some days, the person can shift the attention from the vehicle sounds to their necessary work. So that is the sensory gating, and this is the normal phenomenon and natural phenomenon that occurs in brain of every individual. But
Very
in
interesting.
mesophonics and other population like in hearing loss, tinnitus, and other neurodivergent population like autism, ADHD, schizophrenia, this mechanism is found to be impaired, and there would be like jumble of the information in the brain, and it would be very much difficult for them to regulate their thoughts as well as the emotions.
Interesting. So sensory gating could be one of the factors in misophonia being prevalent or present or severe, maybe, right?
Yes, it could be.
Awesome. A few other things you mentioned. You mentioned that audiologists in India, but I think it's true everywhere, oftentimes have never heard of misophonia, or if they have, they don't know much about it. and that can be an issue because people with misophonia, if they don't know what it is, it seems like a hearing issue, and an audiologist is oftentimes the first clinician doctor they think to go to. What do you think is a solution to getting audiologists who are treating patients and treating clients to know more about it and to know when to recognize it and assess it? Um, how might you go about doing that, either in India or anywhere?
Okay, yeah, that's a fact. Like audiologists are not aware of the misophonia. I'll say especially in developing countries like India and Nepal. I don't know about the world, but in these developing countries, most of the audiologists are not aware. I so do our study also, where only 15% audiologists reported being confident in handling the cases. So I have a experience of around 8 years in clinical audiology, but during this time period, I didn't get a single cases with misophonia. Yeah, it could be like whether the sufferers are not aware of uh, about the professionals, like they are not aware whom to seek the professional help and whom to consult about their problem, or it could also be due to lack of referral, like when the person is having misophonia, most of the people think this is a psychiatric disorder and they will go to the psychologist or psychiatrist, and there needs to be the appropriate referral, is what I think. So this could be the reason for lack of awareness about the misophonia, and in the future we need to create awareness about the role of the professional. We need to highlight the role of the audiologist among the general public as well as among the professionals.
Right, that's a great point. And it, for people who have misophonia, I can speak for myself. When I was a child and was experiencing it, even into adulthood, I maybe I'm naive, but it just never occurred to me that it was a condition or a disorder. Like, I just thought it was something weird about me. I don't like certain sounds, and it didn't, making the leap to, oh, I should go see a doctor, an audiologist, or something, was, I just never thought of it. And so I think that might be a barrier too.
And what I think is most of the people doesn't take is a this as a disorder. They think like it's natural phenomenon, like there are some sound which are like is perceived to be a little irritating or disgusting, like scratching on the board or nail scratching due to their acoustic characteristics of the sound. So people think it's not. What I feel is in developing countries like Nepal, people doesn't take misophonia as a disorder.
Hmm.
So what I feel is there is a need to create the awareness about misophonia as a disorder. We need to provide the various evidences which is proof as it as a separate disorder, and also we need to differentiate this disorder from the other comorbidity, and we need to motivate the sufferers from seeking the help.
Absolutely.
And
It's a big.
another point, I'll just add one point. And in all the studies we did in Indian context, we try to know about the coping strategies the sufferers were using, and the results showed they are either trying to avoid the situation, or uh, like they are trying to ignore the trigger sounds. But these coping mechanisms are definitely not the permanent solution, because it can create the isolation among the sufferers, and which will like impact the quality of the life. So we need to like give knowledge to the general public about the treatment possibilities that can be used among the sufferers with misophonia. And what I feel is there is a more demand of resource on treatment possibilities for the misophonia.
Absolutely. Yeah, just trying to ignore triggers is stressful. It's very stressful. Um, you had mentioned in your presentation about Dr. Jastreboff's, it was tinnitus retraining therapy, and he's tested that maybe for misophonia. Maybe you can explain a little bit about what this retraining therapy for or tinnitus actually is, and how might it be relevant to misophonia? Because I don't know.
Okay. So, Jastreboff model says the cause behind misophonia is abnormal connectivity of auditory system with limbic system and autonomic nervous system. And in misophonia, this is more related because the symptoms and severity of the misophonia increases through the conditional reflex. So through the retraining therapy we uh, reduce the link, we reduce the connection that is there between auditory system and emotional system. We break the conditions that is happening between triggers and emotions, and obviously the person or sufferers with misophonia will get benefit with the TRT. So TRT, talking about the TRT, it is the combination of sound therapy with counseling, intensive counseling. And in the tinnitus population, as I said, there would be hyperactivation or abnormal processing of the sounds in the peripheral levels. And but in misophonia, this is not the case. So the efficacy is doubtful, and there is a lot need of more research in this area. But obviously, we can try the sound therapy with intense sound stimulation to break the linkage between auditory system and these emotional systems.
It's very interesting. Yeah, that it could be very promising. All right. If anybody has any questions, go ahead and put them in chat. What's next? I know you've already done a lot of research on misophonia. What is the next step for you, and what other research are you hoping to do soon on misophonia or related conditions?
Okay, what I want to do is like I said, it's a central phenomenon, and there is a possibility like central auditory processing might get impaired among the mesophonics. So in the future I'm planning to do few audiological assessment to see the central auditory processing. We can like use a speech in noise test or dichotic test among the mesophonics. Then another, like I want to see the cognition, how the level of the cognition will be there in the mesophonics. And next is, as I said, misophonia is prevalent among neurodivergent population as well, like autism, ADHD, or schizophrenics. It's common, but it's very difficult, to assess the prevalence of misophonia on this population. And like those people are really suffering a lot because of their misophonia and hyperacusis, but it's very difficult for the professional dealing with the misophonia to conduct the assessment, because they will be having the communication problem and they won't be able to express how they feel in certain situation and in respond to the certain triggers. So I really want to work on developing assessment protocols for assessing the misophonia in those neurodivergent population. So that's my future plan. Let's see how it goes.
That would be great. Maybe you can answer a question. Is misophonia not the only, but is it really one of the few times where an audiologist might refer a patient to a psychologist? It seems like those two things don't happen much. Is it uh, common for an audiologist to also include for other disorders like tinnitus or something like that, or even hearing loss, to include psychologists and other types of clinicians in the treatment, or is that unique for misophonia?
Yeah, for tinnitus, like there are different cause of tinnitus. Like it could also be due to problem in external ear, middle ear, inner ear, or due to problem in general health condition, or it could also be due to a different psychiatric condition as well. So depending upon the cause and etiology of the tinnitus, I think the role of the professional needs to be highlighted. If it's due to the problem in auditory pathway, or if it's due to the audiological problem, then audiologist can handle the patient with misophonia, with the tinnitus and misophonia. But if it's associated with psychiatric condition, and if their psychiatric comorbidities is more severe, then I think we need to refer the patient to the psychiatrist. So treatment needs to be individualistic. Like we can say, like audiologist can only treat the misophonia, or psychiatrist can only do. So depending upon the severity of the misophonia, and depending upon the comorbidity they are having, we need to highlight the role of its professionals and do the appropriate referral accordingly.
I agree. It's a complicated disorder. It doesn't fit neatly into one field, which can be frustrating, I guess.
In case of severe tinnitus also, where intensive counseling is needed, we do refer to the psychiatrist for the counseling.
Interesting. All right. Doesn't look like we have any questions. Any other points that you wanted to highlight? I read through your paper, and I think you actually ended up answering the questions I have as far as what the findings were. Any other things that you want to point out that you thought were really neat, like aha moments or interesting points that you want to bring up that were unique from the studies that you've done?
Yeah, the first thing is there needs to be appropriate referral for the audiologist for the assessment and management of misophonia. And the different tests which I showed, like ELTL and ALLR, can be used as a clinical correlates of the misophonia. And rather than assessment, like it's the treatment that is necessary, right? Because sufferers needs treatment, right? And from the audiological perspective, there are different approaches highlighted in the literature, like retraining therapy and CBT and neuromodulation technique. But we are not doing that clinically. I didn't see clinical implication of those treatment approaches. So we need to like imply those approaches clinically, and in the future we need to do research on efficacy of those approaches on large population, and ultimately come to the like effective solution for the sufferers.
Excellent
Is what
point.
I want to highlight here.
Yeah, I think that's really an important step. We have a lot of research on misophonia now in a variety of fields, and
There is a lot of research on misophonia, but what I feel is many of them are focusing on developing diagnostic criteria and determining prevalence rate and finding the assessment protocols. So I can see only few papers regarding the treatment of misophonia. So I want to highlight that future focus needs to be on treatment approaches.
Absolutely. That's the big challenge, is to take those findings and make them practical at a clinical office. That's the next big step. All right, Sajana, thank you so much. Really appreciate you taking some time. I know you're very busy. You've got a lot of schooling going on and other studies and everything. So thank you so much for joining us and sharing your work with us. I really appreciate you taking some time out and teaching us more about what you've worked on, the great studies that you've published. And it means a lot that you're studying misophonia in the first place from an audiological perspective. Really appreciate that. And keep us up to date on the new work that you're doing. And we look forward to more studies from you and Dr. Prabhu and the rest of your team as well. And hope you have a great rest of your day. Thanks for joining us so much.
Thank you so much, Chris. And also, I would like to thank you and the soQuiet team for providing us the student research grant. And that is also the one factors which motivated us for doing research on misophonia. And yeah, thank you all.
Sure, absolutely. It all worked out really well, and we're very happy to provide that kind of funding too. So maybe there's more in the future. Thanks so much. Have a great rest of your day. Everybody, thanks for joining us, and take care.